17 years ago, when I started out as an IMG, I had to nearly wait for a year before finding my first clinical job. There was no guidance, there was no mentorship, and everything has to be learned by trial and error. Now I get numerous calls, texts, messages, and emails from not only IMGs in Australia, but from other parts of the world. And they're frustrated. There's seldom any clinical observership positions. They're not getting shortlisted for job interviews, even after passing the AMC1, AMC2, and other similar licensing exams. What we worked out with our team is to devise a very holistic and a complete program. This program is called Clinical Orientation, Medical Coaching, and Mentorship Program, especially for IMGs, and it's got 4 essential components. Number 1 component is online clinical observership. We will actually take you through doing an online medical ward round, looking after emergency patient, medical patient, surgical patient, pediatric patients. What is an expectation from a junior doctor during those ward rounds? How to carry out the orders and be more efficient. Not only that, we'll actually teach you some of the most commonly employed hospital IT system, electronic medical record, how to type in the notes, how to order basic investigations, how to order radiology and type in the discharge letters. The next component of the program is called medical coaching. 50 of the most commonly seen cases in the hospital, we will go through them in depth. How to look after these patients, taking medical history, ordering investigation, and initial management plans. We will talk through that in detail. Not only that, if there's any complication arising in the ward, or if there's any medical emergency in the ward, how to deal with that medical emergency. When you finally get your first job, you're already mentally prepared to deal with these medical cases. The third component of the program is actually very important. It's called 1:1 medical mentorship program. So basically what we are going to do is we'll have the faculty taking the mentees, which is going to be the participants. We'll actually go through your CV and medical application and proofread them for you. We'll make sure that there's no mistake and that application and CV is up to the mark for getting shortlisted. Also, if you get shortlisted for a medical interview, we will be able to offer you practice interview sessions. So none of the questions are a surprise for you, and we'll give you feedback in the areas where you need to improve. The fourth component is that all the participants of this program will get priority access to the popular emergency focus online courses like medical resuscitation course, medical communication skills course, and CV medical application and interview practice session courses. This is a very holistic program. It's got many components, and I'm confident with the skill and attributes that you're going to learn from this program. They're definitely going to put you above the rest of the doctors to get shortlisted for the jobs, and when you finally get that job, to be able to perform at a higher level compared to the rest of the IMGs or even the local medical resident officer. So in order to maintain the quality, we'll have the spots limited. So book your spot in first, and if you've got any questions, please send me an email. The email address is info@emergencyfocus.net, and hopefully we'll see you at the program. Thank you very much.